Hi everyone, my name is Olivia Lorenz, as you can see here by my ID. So, for my video project advocating for older adults, I chose to research the impact of social programs on successful aging, more specifically, home and community-based services, also known as HCBS. Home and community-based services are a variety of health and human services delivered in either the home or the community setting. They are addressing social isolation and they help people stay in their homes for longer. They prevent or delay seeking long-term care in an institutionalized setting. Home and community based services fall into two main categories, which are health services and human services. Health services meet medical needs. Here are some examples, and some of the services offer like a combination of both kinds. All right, so the benefits. They have been identified through research, statistics, personal accounts. There's a lot of peer reviewed literature to back up the benefits of home and community based services. Through my research, I identified some of the most common benefits. The first is cost effectiveness. They can reduce out of pocket costs for families. It can give caregivers the opportunity to get paid for their caregiving, and it's also effective for reducing costs for the government because these programs are oftentimes less expensive than utilizing long-term care services in an institutionalized setting. They provide more familiarity because the people receiving care are often in their own homes, getting cared for by their loved ones. This is more familiar than being in an institutionalized setting where you don't know where you are and you don't know your caregivers. It increases independence because it promotes the individuals to continue pursuing meaningful activities that they may not be able to participate in an institutionalized setting. It offers the opportunity for the individual to get more personalized care rather than just getting the standard care as they would in a nursing home. So, HCBS offer a lot of advantages, but they're also met with some challenges. I'm sure that there are many more challenges than the ones I have here, but these were the most common trends that I found. So, the first challenge is there's often limited access to providers and availability of qualified caregivers. These providers and caregivers, they don't reside with the individual, so they can't provide 24/7 care. Another reason for limited provider access is due to lower reimbursement rates through these HCBS services. And then the high demand for services may lead to increased wait times for needed services. Caregiver burnout is prominent for HCBS recipients and their family. This is because the individual that is receiving the HCBS is often cared for by a family member or a loved one. This provides the caregiver less opportunities to take care of themselves and take a break because they usually reside with the individual they're caring for. The challenge of family responsibility kind of coincides with caregiver burnout because of the increased responsibility the family and caregivers have to make medical and personal needs. If the individual was in an institutionalized setting, a lot of these decisions would be made for them and take the responsibility off of the family. So, home and community based services have unique impacts on certain populations. The first population that I want to discuss are racial and ethnic groups. Some members of this population may not be aware of these services, and that causes them to seek these services out less. Cultural bias of the providers and the social service workers may limit this population's access to services. Many members of this population have distrust for the medical system, which can discourage them from using these services. Studies have found that racial and ethnic groups, on average, utilize these services at a greater rate, so this isn't really a disadvantage, it's just a statistic. The last point I want to discuss is being culturally responsive. Some people argue that these services are not culturally responsive, but then some argue that they are more culturally responsive because they are more patient centered and customized. All right, so Home and community-based services impacts people of differing socioeconomic statuses differently. There are strict income and asset limits that can make people ineligible to receive these services even if they would benefit from them. Um, in more rural areas where socioeconomic status is generally lower, there's often reduced provider availability. Even though caregivers often get paid by HCBS, it's not usually as much as they would make in their traditional jobs, which can produce somewhat of a financial strain. Through the research, I've identified differences in accessing home and community based services based on gender. Women are typically more disadvantaged than men with access to HCBS, which is similar to women's experiences with receiving healthcare and social services. Women are more likely to utilize health services than men due to having generally greater healthcare needs. Women face greater financial constraints in accessing HCBS due to lower incomes and employment rates compared to men. Women are often primary caregivers, which can impact their own access to home and community based services and kind of discourage them from getting them because they're taking care of someone else. So, now that we're familiar with what home and community based services are, we can analyze the impact that they have on older adults aging successfully. So, what is it meant by successful aging? So, in the book by Quadagno, successful aging is defined as not only preventing disease and disability, but also achieving peak physical and psychological functioning, as well as participating in meaningful and productive social activities. So, in conclusion, home and community-based services promotes successful aging through maintaining independence, fostering participation in meaningful activities, and managing healthcare needs. I've identified some challenges and disparities within the HCBS system, and these challenges are limiting the full potential of success for HCBS programs. Further funding and research is definitely needed to reduce disparities, increase access, and overall support the concept of successful aging. All right, and then here are the references that I used for this project. Thank you very much, and have a great rest of your day.